Mary. Okay, hi everybody. This case presentation I really wanted to bring up to the class so I can get some feedback and see what I need to do for this patient. This patient is female. She's age 33. She's Caucasian, married, was an ex-employee of mine, still my patient, and now she works at Absolute Dental. Here's the frontal views. You can see her smile line from this picture, from the first picture. Here's her chief complaint is to fix my grill. Doc, I know you can. Here we go. So obviously missing a few teeth. Her medical history, she had gastric bypass surgery last year, and so she's acclimating to the new diet and lifestyle. She wants teeth that fit her new look. She lost probably 120 pounds or 150 pounds, so trying to make life changes. Her dental history has not received dental treatment for many years before seeing me. She became my employee and I created a treatment plan for her. In August of last year, I did full mouth debridement, then I extracted 7, 10, 11, placed composites. Oh, she has composites existing. No, I placed those composites and then delivered stapling. So there's it, and we did 4 quads SRPs on her. Now her perio is more controlled. Here's frontal view, and here is it open, protrusive. Here's the occlusal views. Here's where I'm having my issues on the, obviously there's some kind of space issues, buccolingually. And MIP, our working side lateral. Extraoral findings are within normal limits. Intraoral findings, she has missing teeth on the uppers 1, 2, 6, 10, 11, 15, and 16. On the lowers, missing 17, 18, 19, and 28, 30, and 31. Existing composites on all those teeth, and decay on some of these, on most of the posterior teeth have decay on them. So her occlusal findings, she guides on her central incisors, as we can see on the guidance pictures, excursive pictures, and her excursive movements are pretty normal for what we've got. So here's our Panorex, and you can see the decay that's on 3, 4, and then those composites on 5, 8, and 12, I actually placed those, and she's doing okay with those. So we'll see how those go. The next image is the cone bean image. This image, I saved it after I planned these in here, and then I wish I could have taken them off, but my computer is kind of flipping on me, so I just saved this one. And these points are now going to be just reference points for the next couple X-ray pictures that we have. So this number 5 is this picture, and you can see buccolingually I only have 4.26 millimeters. I placed in a 3.3, I planned a 3.3 implant in there to see the space, and it just looks really tight in there. So there's that. Here's the 10 region, 4.98 millimeters, and then 11, 5 millimeters. Her casts, I put some denture teeth in there to see what's going on, and it's because of the lack of the difference in space between 5 and 8 and 9 and 12. Anyway, so I placed them in there, and she has pretty wide front teeth, and so that the upper left lateral is actually a central denture tooth. Diagnosis, type 1 philosophical patient. Okay, proposed treatment plan. I could place 4 implants, maybe 2.9 or 3.3 Straumann implants with smaller teeth on the right side. I could do just an entire horseshoe bridge from 3 to 14, possible root canal on 12. I could do a 2-stage, do a bilateral sausage technique, and then 4 implants, which would feel pretty cool, but I've never done that. And then, or I could do 1 implant with 2 crowns on the upper right, and then 2 implants on the upper left. So these are my treatment plan, and that's that.
Do you know why she's getting so much caries? Is it the diet, or is it the tea?
So this was the decay was definitely there before her weight loss, and I don't know if she was bulimic, or she said that she just has bad teeth, had bad history of bad teeth. And I do see her sister, and I just delivered a full upper and lower denture, and her sister's only 35.
Yeah.
And she didn't do gastric bypass or has drug history, so it might be genetic.
The roundhouse of the horseshoe shape, that is the last resort, because she's got this predilection for caries, and she gets caries in one. You're now replacing the whole FPD, so probably not a good idea. I still like your implant option. I think you have calculated the bone pretty well. If you want, you can always graft on the facial to make sure that there's no exposure later on. But
do you think that the 3.3s are too small to place?
No. I think it's appropriate for the space. And again, remember, if you ever feel like you want to control the occlusion, you try and see if the patient is going to buy into wearing an occlusal guard. It sounds so simple, or nobody wears it, but if you tell them, look, if it fails, you're responsible with all the stuff you're doing with your teeth, then it's on them. So, and I should get that, but I don't do it for every patient, but I get a consent when I that makes it more formal and serious. And I understand that she's on a, lifestyle change, so she might be amenable to every advice you give. When she came back to you, she obviously trusts you, so I would throw in the occlusal guard. Or make one for free.
Okay.
But you need 2 millimeters of bone buccal lingual, so it would be.
That's what I said. He doesn't have that, and so you might have to graft on the facial, but he should still be able to get the implant within the bone. So
Okay, so then during placement of implants,
if you have a dehiscence, you can definitely be ready to graft. I would think an allograft should be okay, but Kuros, or I don't want to say brand names, but yeah, or somebody would say You could use an allograft like for the bone turnover and then about a scaffold with bios, or you can mix it up, or you can mix it up with some autogenous bone. All of these are good options except just bios. And those you could find an argument for that, but it's a slow turnover.
Okay. And you think there's enough room definitely on the right side to place 2 implants?
Let's take a look at that. I can pick up on the right side, isn't it?
It's I guess it's the left on the screen, but it's
I think so, but I'm not getting the concern. Show me the occlusal view of the intraoral photograph. I didn't pick up on that thing. Okay. So what is your plan here? This is inverted. Is this correct?
This is inverted. I did not correct these. So this is inverted. So left side's right side.
Okay, let's get that. This is correct, no? Also, for the foot.
Every picture. So on my not over there.
Left foot photograph is the one.
No, I think
This is correct.
no, you did just the same.
Alright, your concern was which one?
That on the right side, I wouldn't have enough to place 2 implants, or that it would give me an unfavorable cosmetic result by having smaller teeth on the right side.
Show me your setup now. That's a good point.
And I have that set up with me too. We'll just look at it because this is not giving me the correct picture.
To get the space. Yeah, you can do that.
Just to do a one single crown on 23, I believe, and then so no, not to close all the gaps, but just to do a crown on the one tooth that is pretty broken. She doesn't mind the gaps. We discussed that, and she's not interested in doing like orthophil lowers to close the gap. She's really just more concerned about the upper plate, and I'm planning on doing a bridge on 27 through 29, and then a lower partial to replace the lowers.
Can you frontal view of the bite?
It's pretty deep.
Yeah, so that space doesn't concern you a little bit?
Absolutely, it concerns me.
Well,
That's why I'm bringing it up. We were just gonna do it, and then once I started planning, I'm like, this is probably a good thing to do.
You do have an issue with spacing on the right side. The occlusal view is pretty revealing. And that premolar is rotated. Yeah, this begs some ortho intervention. But you also might, do you have enough anchorage to move these?
Question.
Yes.
Can you get the occlusal view on it? For number
4.
6 and 7, do you have enough facial bone, or do you think he's going to need some horizontal bone?
Definitely, I think because of the way the two occlude, that's where the space issue is happening. So I do think that, yes, you're saying on the buccal side of...
The buccal side looks like the bridge is so narrow, or?
Yeah, I think it is quite narrow. Maybe we can... But pretty much, yeah, that ridge right there, you can see it's pretty thin. So I put a 3.3 on the smallest portion to see, if that would even fit, and yeah, it would. So maybe if I put two of them next to each other, that would be able to fit.
You don't have the space though to make it look. I looked at the teeth arrangements. It's awkward. It will be awkward.
Yeah.
You will have to manipulate and again, crowning the premolar is. Can you move the teeth? How long would it take? Orthodontically, if you were to manage it, how much time would it take to get the spacing? Yes. Sorry, I didn't hear you. Yes.
Because she's missing a lot of posterior teeth on the bottom. So would you consider doing some kind of a composite onlay on just on the posterior teeth to raise your vertical, and then you could make your partials off that? With that?
I would consider it. Composite resin restorations are not going to last long term, but short term, yes. Long term, again, this takes a complete reconstruction. And again, I'm trying to look for a simpler solution, but I'm not seeing it. So your point is well taken. But composite resin, yeah, you're bonding to enamel, you might be able to get some decent results, but they wear down fast, and eventually there will be leakage. So, but then if you want to crown it, that's a huge expense factor then. So if it's a short-term goal, while she collects finances to do a comprehensive treatment, I think that's an excellent way to manage it. But there was another question. Yes.
If time is not concerning, then she could go with the orthodontic to rotate that number 5.
Yeah,
Space.
that'll help.
And if that is a concern, and that she wants to have something right away, and probably you put it in let number 6, and then you can deliver number 7. So that way we can avoid the black triangle. Obviously, we're going to have black triangle.
Yeah, you're right. All of these are good suggestions. The thing is, rotating that premolar. Can you show the close-up view? If he's going to do that, that means an orthodontic intervention, right? Might as well do an orthodontic setup. Make sure you can tell the orthodontist where you want things moved, so you have ideal proportion. So if she's going to go get orthodontic treatment, and then go from there. But so things would be much simpler. Now the question about bone, yeah, we probably use a graft bone because it's pretty thin. It might be at the time of placement, or you can do it before. Most likely at the time of placement. So all of you are raising good points. Unless we do an orthodontic setup and see where the teeth need to be moved, you could get into a space issue. And so I saw your wax pattern here. The lateral actually looks wider than the canine, so its canine looks cramped up.
Yeah.
So that's not going to look good.
Yeah. I just showed that in there pretty much, but I figured if I made the canine regular and made the lateral small, that's even more obvious.
Yeah.
Especially since she has like a V shape, you only really see lateral to lateral. So I'm kind of hiding it, but you're right. That's a huge concern.
See, so if you do the math, I mean, if you want to take control over this, you have to take control over the natural teeth because you want to get the proportions right, or you have to get orthodontic treatment to get the space right. Either way, it's going to become expensive, and the vertical dimension could be restored because I think she's lost vertical dimension. And the other thing is, while you're focusing so much on restoring the anterior teeth, the posterior teeth, she has no posterior support. So everything you do on the anterior is going to take the trauma because of lack of posterior support. So yeah, you got to make sure that she has something to support her posterior occlusion.
Okay. Cool.
If you look at number 3, if you derotate it, you get a little space. So you can discoloze the premolars.
Yeah.
You also derotate number 5 as well. And you can get a little space there.
Okay.
Why did your assistant leave to go to the other dental office?
Because she wanted to be a back office assistant and she never has before, so I mean, she couldn't do that. She couldn't train at my office, so she has to go train somewhere else, and maybe she can come back if she's got skills, but she was doing front office only.
He was ready for that question. Lozana, you want to comment on this? Thank you, let's take a break.
But I think you also need to look at the bike.
Take the time.